I'm British originally and moved to the States 30 years ago to work at Vanderbilt University as an academic, and then moved into private practice a few years later. And so I was in private practice for 25 years before coming to New Zealand. Well, I reached 60 and I wasn't happy in private practice. I saw my work conditions deteriorating, and I thought that I would move to New Zealand for a while at any rate to try a different system and to try and recover a little bit more enthusiasm for the job which I'd lost. Well, New Zealand is a wonderful place for going outside. There's hiking, there's walking, there's water sports, there's golf. There's anything, mountain climbing, you name it, there's everything. It's all pretty accessible. Well, we spend a lot of time seeing the sights around here. There's a lot of places to go see. There's a lot of country walks to go on. We like to go to the beach, pick up seashells. We've done a little bit more athletic activity than I'm used to doing back in the States. Do a good deal more walking. I play plenty of golf. And we've been touring New Zealand, which has been a great experience. The South Island of New Zealand is spectacular, and we keep on going back. We've also spent time traveling elsewhere. I've been to Australia for the first time in my life, and thanks to the travel allowance for educational purposes, I've just come back from a meeting in Spain, so not too shabby. I walk to work. I never used to walk to work. I couldn't walk to work in the States. Everything was in a car. So I'm actually getting a little bit fitter, which is terrific. And I've managed to lose a few pounds, although it may not look it. So all in all, that's great. And we spend much more time as a family doing things outside the home. Maybe because the children are a little less involved with their friends than they were in the States, but we now do things like going to the beach, which is half an hour away, and they come and join me on the golf course and knock a ball around and that kind of thing. So there's a lot more outdoor activity than we had back in the States. Everyone was expecting us, and we were welcomed with open arms. It has been a very good experience, and the key thing about New Zealand education in our experience has been the emphasis on personal growth with the children. There are a lot of details to get sorted out before you come. It turns out that most of them aren't as big a problem as you think they're going to be. It's possible to open up a New Zealand bank account while you're in the States and to fund that, and that's very easy to do. The school system, partly because New Zealanders are big travellers, the school system is used to people coming and going through the school year. So it was very easy for the children to join a local school and to be accepted. They're a bit of a Seventh-day wonder. They don't have too many Americans there, so that was good for them, and they were received with open arms by the school in a very positive way. The travelling bit was made easy. There's an allowance that the hospital gives to you to travel, so that wasn't a problem, and they also find a car for you and a house to rent. So that was all very easy. We were met at the airport and taken straight to the house. Because we were coming for a year, we decided it made more sense to buy a car. So we went to the local Toyota dealer and bought a second-hand car, which didn't cost that much. It was like 16,000 New Zealand dollars. And they have a deal whereby they will guarantee a buyback of the car at the end of the trip. The system here is dramatically different to what it is in America. While practicing in America, one was constantly aware of the lawyers and the potential for lawsuits on almost everything you did. My malpractice insurance, I think my last year was $22,000 in Tennessee, which is probably average for the states. My malpractice insurance in New Zealand is, I think, 1,200 New Zealand dollars, so that's about 1,000 US dollars. And in fact, lawsuits are really not an issue with medical practice in New Zealand. There's a thing called the ACC and an arbitration process, which more or less take the lawyers out of play unless there's a fairly egregious example of malpractice. So in general, people are not concerned about malpractice, and that's a very liberating thing. Well, from a work point of view, what I've really enjoyed is the collaborative efforts by all the doctors involved to try to come up with the best treatment plan for the patient. There is a lot more consultation between the various doctors here at the hospital than I'm used to in America, and I really enjoy that. There's a lot of clinical conferences. The work day starts around 8:15, and the session will end around 12. The new session starts around 1 and goes through till about 4:45 or 5. People generally do not stay after that. There is an on-call arrangement whereby there is a consultant on call, and there is usually a registrar who takes primary call and calls the consultant in if needed. I have trainees here. They're called registrars, and they are equivalent to second and third year residents in the States. So I have trainees, which is wonderful because they keep me on my toes, and we can do a little bit of teaching and learning together. We're called consultants here in New Zealand, not just attending physicians, and that name really says it all. We do consult a lot. In America, I was a general radiologist covering a list from about 8 hospitals, and I would read from that list, which was a mixture of ultrasound, plain films, MR, CT, all the general gamut, nuclear medicine. Whereas here, on a given day, I'm concentrating on a specific modality as a matter of general principle. So that's a little bit different. Now, the pressure of work is significantly less in New Zealand than it is in the States. There's a lot of cancer, we see a lot of it, the imaging is quite complex. There is some trauma, but not nearly as much as I'm used to seeing. There is an opportunity for interventionalists to do quite a lot of work. One of the interesting things that some of my colleagues are doing, which I'm not doing, is musculoskeletal ultrasound, which is an area of expertise which I don't have, but which is very useful, as I've come to discover, and something that I think ought to be done more in the States than it is at the moment. The great thing about practice in New Zealand is that clinical medicine has once again become king. It always was here. In the States, I found that the medical practice has gone to test-based medicine, and clinical skills had eroded. That is not the case in New Zealand, and it's very refreshing. The travel allowance and educational allowance is quite generous. I think it's 16,000 New Zealand dollars per year, and it can roll over, and really that is extremely helpful for encouraging you to go to courses. And I've been to 2 since I've been here, and I'm going to be going to a 3rd one in Australia in a couple of months. It's encouraged, it's easy to take the time off to do them, and it's all part of the learning process. And I would have to say that being involved in a very personal way with patients' care makes the job a great deal more interesting than I found it back in the States. The things that I've really enjoyed about New Zealand radiology environment is the teaching and the interactive clinical discussions with my colleagues, both radiological and non-radiological. There are a lot of meetings to go to. We're expected to provide leadership at some of those meetings. That has been challenging, but it's meant that I've done more reading than I've done in a long time. The ability to go to meetings without people complaining about taking time off is wonderful, and the fact that I get paid for it is also great. So, very positive experience.